sticking to the common errors made by conventional medicine when diagnosing and treating thyroid issues, what are the most egregious that you see that anybody listening to this, like if they wanted, I love to give nurses tools for teaching, but also to give value to their patients. Like if they're, a clinical nurse and patient is on a new thyroid medicine or just had the dose change or something like that, being able to give them something else, even if they are constrained by the conventional medicine environment that they're in, have for them to be able to give their patients resources, other places to go learn. Obviously, your podcast. What are the most common mistakes that you see conventional medicine making in the diagnosis and treatment of thyroid issues?
Yep. Okay. So number one, I mean, the most blatant is the testing. We know that conventional only tests TSH and maybe free T4. And those are actually the two tests that I really could care the less whether someone gets or not. Like, yeah, we'll test them. We'll look at it. It gives some data, sure. Especially if the TSH is screaming, if it's above that 4.5 and you're actually flagged high, then obviously, okay, this person has hypothyroidism. We need to dig a little bit further. But doctors who only rely on, or practitioners that only rely on TSH and treat and diagnose based on that.
Yeah.
And that's really going to hurt people. I mean, I can't even tell you that is really going to hurt people. Number one, it's going to under medicate many individuals, because I have seen countless TSH values that are actually between a 1 and a 4.5, and this person still has hypothyroidism. I have seen under a 1, like literally the TSH is slightly suppressed and they still have hypothyroidism. They're not being treated properly because we know that T4 only. So now I'll kind of weave that into the treatment because it's all tied together. So we have a stat from A4M that I heard years ago, and it really stuck with me because it's accurate. And I often get happy when I hear somebody else say a stat that I've been saying for a while. 2% of the population do well on, and that was literally the wording used, do well on T4 only. There's a whole other argument there. Like, what does do well on mean? Yeah. Is that person just happy carrying around 20 extra pounds and being tired? I don't know. So 2% do well on T4 only. I say 0%, but 2%. And then 98% need T4 and T3 or T3 only. So if you look at standard of care, 98% of people in conventional medicine going through standard of care are given T4 only. I mean, that's a shame.